Chairman, ladies and gentlemen, good morning. My name is Wang, a cardiac surgeon from Fuwai Hospital, Beijing, China. It's my pleasure to participate in the EAX annual meeting, and today I'll present the early results with the Cohort 6 LVAD in China. I have no declaration. First, I introduce my hospital. The Fuwai Hospital is a specialized hospital for cardiovascular disease, and it is the biggest cardiac center in China. The surgical volume is about 15,000 cases, and the PCI is more than 50,000 cases per year. This is the current status of the durable LVAD in China. The durable LVAD is a new technology in China, and it was not used until 6 years ago. Since 2017, 515 durable LVADs have been implanted in 85 hospitals. And now the durable LVAD use is increasing very fast. Now in China, 4 brands of durable LVADs are available now, and the LVAD is from Japan, and the other 3 are all made in China. The Cohort 6 is the latest one. It got approved just 4 months ago. The Cohort 6 maybe is the smallest and the lightest full maglev durable LVAD in the world. It's only 90 grams. And the Cohort 6 has 2 key technologies which make it smaller and lighter. The first is the axial magnetic suspension bearing, which can reduce the diameter of the pump. And the motor is separated from the blood flow path, and the heat transfer is less. The second is the integrated control system. Only one set of coils controls both the rotation and suspension of the rotor, so this can reduce the size and power consumption. The Cohort 6 has a flatter HQ curve than the HANMI 3, and its maximum flow is 10 liters per minute. The preclinical animal test showed excellent safety and efficacy. We observed 6 sheep for more than 60 days, and no device disorders or severe complications were found. We also led the clinical trial of Cohort 6 in China with other 11 centers, and 50 patients were enrolled. The follow-up continued until 1 year after operation. The outcome measures include the safety and efficacy evaluation. Now I will introduce the early results of the clinical trial. The average age is 50 years old, and most of them are male. The average BSA is only 1.87 square meters. I think it is smaller than the European patients. The frequent etiology is dilated cardiomyopathy, and the second is ischemic cardiomyopathy. All the patients had advanced heart failure with average LVEDD 77 millimeters and the average LVEF 24%. 1 patient was on the support of ECMO, and 3 patients were on the support of IVP before the operation. 26 patients had isolated LVAD implantation, and the others had combined procedures. 2 patients died after the operation caused by acute right heart failure and recurrent ventricular fibrillation, respectively. The in-hospital adverse events include 2 right heart failures and 1 surgical bleeding, which required re-exploration, and 2 recurrent ventricular arrhythmias. No stroke, no pump thrombosis, and no jet bleeding was found during the hospital stay. There are 4 new deaths during the follow-up period, and the 1-year survival rate after implantation is 88%, and no pump replacement surgery occurred. All the patients after operation had improved cardiac function and a better quality of life. During the follow-up period, there are 40 patients ongoing support, and 1 BTR, 3 BTTs, and 4 new deaths. The longest patient on device is about 20 months, and the average supported duration is about 15 months. 2 BTTs are caused by the recurrent ventricular fibrillation, which were refractory to medical therapy. And the other was caused by the acute right heart failure just 13 days after the operation. The BTR patient is a 58-year-old male diagnosed with severe aortic stenosis with a very huge left ventricle, and the LVEF is only 15%. After the 10 months support, the patient recovered, and we removed the device. Now the patient goes back to work and lives in a normal life. In the 4 follow-up deaths, 2 are caused by the right heart failure and secondary multiple organ failures, and 1 was caused by the retroperitoneal hematoma after the cholecystitis resection. And the last one was caused by the coagulation disorder and secondary cerebral hemorrhage after the COVID-19 infection. There are 5 patients with germline infection with positive culture, but none of them need surgical treatment. After the disinfection and medical therapy, all the patients recovered. Another problem is the ventricular arrhythmia. There are 6 patients had recurrent ventricular fibrillation, required defibrillation. 2 of them received heart transplantation due to recurrent ventricular fibrillation refractory to medical therapy, and 4 recovered after medical therapy. 2 patients suffered from the major bleeding. 1 GI bleeding recovered after medical therapy, and the other died of the severe retroperitoneal hematoma. There are 2 patients with right heart failure secondary multiple organ failures. Both of them died at last. And only 1 patient had cerebral hemorrhage after the COVID-19 infection. No thrombosis or hemolysis was found during the follow-up, and no device disorders or replacement occurred during the follow-up. In brief summary, the early results show that the Corheart 6 LVAD is safe and effective for the treatment of advanced heart failure. Major complications include driveline infection, the right heart failure, and ventricular arrhythmia. Stroke, GI bleeding, and thrombosis incidence is insignificant in this group, and longer follow-up is needed to observe the long-term safety and efficacy. Thanks for your attention.
Thank you very much for such an important presentation. Again, my question, what about the anticoagulation protocol after the implantation of this pump? Do you starting with heparin, and what was your anticoagulation regimen?
The anticoagulation, yeah.
Anticoagulation regimen.
Anticoagulation method is using the warfarin and aspirin. Yeah. And we keep the INR just about 2. Yeah. Yeah.
And you started with warfarin the second 3 days after the implantation, or the first bridge with heparin? Or
we use
what
heparin.
was the first step after the implant of the pump?
Yeah, we use heparin at first after the operation, and the next day we began to use the warfarin, and after about a week we began to use add the aspirin. Yeah.
Thank you very much.
Thank you.
Thank you very much for this excellent presentation. So, based on your experience with all the devices and especially with this device, what would you say is the major advantage in your hands for this pump? If you can choose and decide which pump you can use or you want to use, what is, so to say, the most advantage of the new pump? That it looks very promising, the Corheart 6.
Okay, in my hospital's experience, compared with other two pumps, the Corheart 6 is smaller and easier to implant. Yeah, it is only just like a ping pong ball.
Yeah, it looks like that is the very nice pump and a very nice tool and a very promising future for this device. Thank you very much. Are there any more questions? Ah, excellent. Please go ahead.
So, good morning. Lorena Montes from Colombia. And it was a great presentation. The data, the numbers, incredible. I want to know something that it's not very orthodox to ask, but I really want to know the price of this device.
The price of this device?
Yeah. I'm sorry for asking that,
but
I think
price
everybody has that in mind.
The price in China is let's say, about $500,000 RMB. In China, the RMB in China.
In dollars.
$500,000. Yeah.
$500,000. So
yeah,
it's
more than $500,000.
$500,000. It's more
580 not dollars. About $10,000.
$10,000.
$100,000. Yeah.
So it's cheaper than Harmetry. That's what I wanted to know.
Yeah, it's the cheapest one in China also.
Incredible. Thank you.
Thank you.
Dr. Wang, thank you very much for excellent presentations, excellent results in China with this pump. And just to inform the audience that we start together, and Gloria is one of the investigators of European trial. So we will perform a CE mark certification trial in Europe based on this data. And we hope that this pump will be available first for the trial end of this year or beginning of the next year, and after successful trial for us available too. Thank you.
Yes, thank you.
For your pioneering work.
Yeah, thanks.
So, once thanks again for this excellent presentation, and we're really looking very much forward to further collaboration.